Probably the most common cause of a white tongue is dehydration. And that can be systemic dehydration due to poor fluid intake, or medication that causes fluid loss, and that could be as part of treating heart disease, for example. Someone could be on a diuretic medication, and that results in a fluid loss and a little bit of drying. But probably more common with it is the mouth breathing. Mouth breathing results in drying, desiccation of the tongue, and that white patch and furry sort of looking tongue. And the characteristic of that cause of a white tongue is that when you go and get a tongue depressor or whatever you've got and go to try and scrape it off, it doesn't scrape off. The white patch stays there. So that's a dehydrated tongue. Okay. If you go to scrape it off and the furry stuff comes with it, that's probably thrush. In terms of what's going on, and then from that point of view, you got to think of diabetes as an underlying medical cause of what could be happening. And from that point of view, making sure that testing for that is advocated. Likewise, they could have been on some antibiotics recently, and it's got an oral thrush overgrowth as a result of having been on antibiotics, or other medical conditions. They're immune deficient or on immune modulating medications that weakens their immune system, for example. The white patch that you don't want to stuff up is what we call leukoplakia. And leukoplakia is a white patch which is due to mucosal trauma. And the main form of trauma that we're concerned about is the trauma that's environmental, such as from cigarettes and alcohol, that leads to pre-malignant and then malignant changes. So some leukoplakic patches don't wipe off of tongues, and they are the ones that are of great concern. And then there's a whole range of other oral pathology things. I won't go into the boring details, but things like lichen planus, for example. Another cause of the striations and so forth, depending on what variation of lichen planus they've got, which usually affects the cheek. Occasionally, it comes over and travels onto the tongue as well. So, in terms of typical white furry tongue, if it scrapes off, think of thrush. If it doesn't scrape off, think of dehydration. Think of mouth breathing. And then the medical history and so forth will help clarify that. So hopefully that answers that and gives you a little bit more of a definite answer.